Hello there. Today we'll be talking about cervical cancer. What is cervical cancer? Stay tuned as we delve right into this topic. Welcome to your Health Today with Dr.Yide, where I talk about your health and wellness. I am Dr. Olaide Jinodu. If you're not yet subscribed to this channel, I know you are missing out. Why don't you subscribe right now and hit that notification bell so you get notifications every time I post new videos. Now, straight to the chase. Cervical cancer. Now, there are two words here, the cervix and cancer. Now, the cervix is the door, the entrance to a woman's womb. And we all know what cancer is, I assume. Cancer is any disease that spreads all around the body, to cause havoc. In layman terms, let me try to make that as simple as this. There's something called a life cycle, a cell life cycle. Every cell in the human body goes through a normal cell cycle. The cell is born, the cell differentiates, grows, and then dies. Now, this death is known as a programmed cell death. We call it apoptosis. Usually, these cells should follow instructions of birth, growth, and death. Cancer cells are cells that have lost their ability to die. They are immortalized, so to speak. So they start to cause havoc wherever they start from. You understand? They grow bigger than the environment and they create their own blood vessels at the expense of the host, that's the human body. And they start to spread to other places, causing this havoc. Now imagine somebody having this in the cervix. So it's a no-brainer now. Cervical cancer occurs only in women. That being said, what causes cervical cancer? The number one cause of cervical cancer is HPV, the human papilloma virus. Now, this could be transmitted sexually or for some non-sexual means. Secondly, a genetic susceptibility to this virus can also predispose a patient to cervical cancer. HIV as well can also predispose a patient to cervical cancer. Why? Because this person is immune compromised and doesn't have the capacity to resist the HPV virus. But primarily, cervical cancer is caused by the human papilloma virus, HPV. How common is cervical cancer? Cervical cancer is the third most common malignancy in women worldwide. That being said, what are the signs and symptoms? Abnormal vaginal bleeding, especially after sex, vaginal discomfort, malodorous discharge from the vagina, dysuria, pain on urination. Now, understand that there are other things that could cause this. So if I've just scared you, I apologize. Don't get scared unnecessarily. Allow your doctor make this diagnosis. What are the risk factors to cervical cancer? Multiple sexual partners, having a very promiscuous male partner, and having sex at a very early age. Now, how can this be diagnosed? There's something called a pap smear that a woman should do regularly. In fact, from the reproductive age. Don't try a pap smear for a virgin. If you try it, you will get sued. So from the pap smear results, a diagnosis could be made of either cancer or not. How is cervical cancer treated? It depends on the stage at which the cancer is discovered. If it's discovered early, yes, it can be treated and has a better prognosis. Prognosis means an outcome, the outcome of the treatment. So the earlier the disease is discovered, the better the results of treatments. So the treatment, I won't talk about them. You go see your doctor to learn about, or you see me private, or you chat me privately to learn how to treat cervical cancer. How is it prevented? Number one prevention is by receiving the vaccine. Now, the commonest vaccine in this part of the world is the Cervarix vaccine. The Cervarix vaccine is the vaccine against the human papilloma virus. Now, there are about 9 serotypes, but the Cervarix just works for 2 major ones. We still recommend Cervarix, especially for children, the girl child from age 9. And yes, men too need the Cervarix vaccine. Fine, you don't have the cervix, but you could have cancer of the throat. which is the counterpart of cervical cancer. So it's advised that for your girl child, start vaccinating them from the age of 9. Once a woman has started indulging in sex, you need to see your doctor to test you before you get the vaccine. Now let's talk about the prognosis. In a nutshell, there are about 4 stages: stage 1, stage 2, stage 3, stage 4. So if it's treated at stage 1, the prognosis is about 90% and above of 90%. So meaning that's very good prognosis. If it's discovered at stage 2, the prognosis is between 60 to 80%. If it's discovered at stage 3, the prognosis is approximately 50%. If it's discovered at stage 4, at this point, we usually say it has metastasized, has spread to other parts. Well, the prognosis is pretty poor. It is less than 30% at this point. So one take home from this discussion today is for you to get tested. Ensure you get tested early enough and get the vaccine against human papilloma virus. If you just love this video, I would have you like, post a comment, share, and subscribe to my YouTube channel. So we'll meet again, same place, same time next week. Don't forget, health is wealth. Bye.